Hello, we'll continue our lecture about how the fluid are gained and lost inside your body. The ECF collect around 2200 ml from its components through absorption through the digestive epithelium. Another 300 ml come from the metabolic activities inside the cell. 1200 ml are lost of the contents of the ECF through urine, as well as 1150 ml are lost through the respiratory losses and insensible perspiration. Another 150 ml are lost through the fecal loss. Variable amount are lost through the sensible perspiration. And from this table you can see how the water is balanced between the source and the methods of elimination. So you can see the daily inputs is like 2500 ml, which is lost as a daily output. If we look as a summarize for the buffer system that occur in the ICF and ECF, you will see that both of them have a common system, which is for protein buffer system, and the ICF have the phosphate buffer system, while the ECF have the carbonic acid bicarbonate buffer system. So basically we have two systems separate for each type of fluid, and we have a common system for both of them. For the common system, the protein buffer system, that includes three other buffer systems. The hemoglobin buffer system for the red blood cells only, and for the ICF, and the plasma protein buffers for the ECF. And they have a common buffer system for the amino acid buffers for all protein. Now we're going to talk about AVP and its major regulation. It's a major regulation for osmolality and how it regulates osmolality. This is controlled by specialists. The secretion of AVP is controlled by hypothalamus, which sense the osmolality of ECF and adjust the secretion of AVP from the posterior pituitary. A rise in osmolality will promote AVP, while decline in osmolality will switch it off, because the AVP major role is retaining water by the kidneys. If the urine flow rate reaches around half a ml per minute, this stimulates the stimulation of the AVP secretion. Normally, within an hour of drinking 2 liters of water, the urine flow rate comes back to 15 ml per minute, and this will induce the shutdown of AVP secretion. Thus, the water excretion and retention is controlled by AVP. This figure will summarize the last slide. You'll see when the hypothalamus senses the change in osmolality of the ECF, it will stimulate posterior pituitary to secrete AVP, which will stimulate kidney to retain water. While in case the osmolality is okay, the AVP is shut down, and the volume of water excreted is increased. If we talk about the sodium balance, the main constituent of osmolality, the total body sodium of average 70 kilogram man is approximately 3700 millimole. 75 of that amount is exchangeable, while the other quarter have a slow turnover rate, and most of the exchangeable sodium are in the ECF. So it's tightly regulated ECF in plasma and interstitial fluid, around 140 millimole per liter. In disease, the gastrointestinal tract is often the major route of sodium loss. And this is a very important clinical point, especially in pediatric, as this may cause deaths from the loss of salt and water depletion, or from the depletion of sodium and salts. The output of sodium is regulated by two major hormones, the aldosterone and the AMP. This figure shows how the balance of sodium is regulated. The intake from the digestive system, as we said, 75% are exchangeable in the ECF, while the quarter are only stored in bones and tissue. Some of these sodium are lost through the renal losses. This matches the intake. And sweat have like very small amount, trace amount 5 millimolar per day. We'll see from this figure how aldosterone control how the sodium is retained. In the incidence of falling of blood pressure, sodium had been retained. So in this case, the kidney secrete the renin, which activate the angiotensin 2 hormone through 3 steps until activating the adrenal gland to secrete aldosterone, which ordered the kidney to retain sodium. While in case increased blood pressure, the sodium had to be released by the kidney, so the aldosterone effect is lowered through the lower induction of renin. So the fluid and electrolyte balance is central in the management of any patient who is seriously ill. The measurement of the serum electrolyte is the most commonly requested biochemical profile and yield great deal of information about a patient's fluid and electrolyte status and renal function. You will see from this table how the biochemistry department will have an clinical report showing the first figure shows the clinical report electrolyte results in patient with chronic renal failure, while the other one will show a guide to the electrolyte composition of GIT fluids. In this slide, you will see a summary about the last lecture, about the concept and vocabulary, and as well you can see about the summary about the water and sodium balance. And this is one of the important slides which summarize the last lecture. We'll shift to another topic, which is the acid-base balance. This balance production actually control the amount of hydrogen ions, which these hydrogen ions control the pH. As you know, the body generates acid during normal metabolism. In the kidney secrete hydrogen ions into the urine, generate buffers that enter bloodstream. The lung affect pH balance through elimination of carbon dioxide. We have two major processes: the acidosis, which result from the low plasma pH, and it must be less than 7.35. While the alkalosis is state where the plasma have a higher pH and it is above 7.45. The acidosis and alkalosis affect all body system, particularly nervous and cardiovascular system. Both are dangerous, but acidosis is more common because normal cellular activity generates more acid. There are three major buffer systems for acid-base balance disturbance: protein buffer system, carbonic acid bicarbonate buffer system, phosphate buffer system. The protein buffer system regulates the pH of both fluids, ECF and ICF, and they interact together in the other buffer system, while the carbonic acid bicarbonate buffer system important in ECF and the phosphate buffer important in ICF and urine. How the kidney responds to the acidosis? It secretes protons, the activity which activate the buffers in the tubular fluid, leads to removal of carbon dioxide and reabsorption of sodium bicarbonate, while the renal responds to alkalosis by declining the rate of secretion at the kidney, and tubule cells do not reclaim bicarbonate in tubular fluid, and collecting system in the kidney transport bicarbonate into the tubular fluid while releasing strong acid HCl hydrochloric into the peritubular fluid. The disorder in this acid-base disturbance will lead to many of diseases. The diminished respiratory performance, abnormal renal function, cardiovascular condition like heart failure and hypertension, condition affecting the CNS, neural damage, and will affect as well the respiratory and cardiovascular reflexes. We'll see from this figure, you will see when the hydrogen, you'll see due to acidosis, there is addition in the proton ions as a way of trying to shift into balance. This hydrogen ion will form a carbonic acid which got released through the lungs. In other ways, it will have a bicarbonate that come from the side, the bicarbonate reserves. When the sodium bicarbonate is breaking to sodium and the bicarbonate ion, this bicarbonate ion will have an effect on lowering the severe conditions of the severe high concentrations of protons. The other ways, the other buffer system can absorb the protons from the ECF, and as well the protons can be secreted by the kidney. If we look how the body is responding to alkalosis, you will see when there is removal of protons from the system. There is removal for if there is a lot of removal of the proton from the system, the bicarbonate can be there is an input of a bicarbonate when water attached with the carbon dioxide. This will increase the protons, as well as there is a balance toward formation of a sodium bicarbonate in the bicarbonate reserves. The kidney as well can generate proton to compensate the loss of protons and will secrete the bicarbonate as well. There is other buffer system as well that release protons. And this is and next in the next topic we'll talk about the electrolyte imbalance and osmolarity disorders.